My name is Leslie Prescott. I'm here just to give you my perspective on our theories class in occupational therapy advanced practice. Let me tell you, I am so happy and I have benefited greatly from this course. And just to relearn some of the theories out there, the 6 foundation theories that we basically reviewed and had ongoing thorough discussions about it, really helped me grow as an occupational therapist. For an example, we have the person-environment occupational model, the person-environment occupation and occupational performance model, the ecology model of occupation, the model of human occupation, occupational adaptation, and the Kaiwa model. And let me tell you, I have applied each and every single theory to practice. And by doing so, I found out as a therapist that it really changed the way the patient and also my coworkers viewed and value the role of occupational therapy, how we are caveat to change and for function. So just to try to put this in all proper perspective, what I really have learned from this course is that the models that we use, or we use in occupational therapy, the 6 models that we learned through this program are all basically focus on client-centered goals. They are meaningful goals, volitional goals, goals that the patients would like to engage back into occupation. It's client-centered. You know, our approach, I like to sway away from the medical model and get back to the root and the history of occupational therapy, which is getting a person back into doing occupations that are meaningful to them. And also another thing that we have to take into consideration as an occupational therapist is that we're dynamic beings. We do not live in a vacuum. We are basically living where the environment impacts on a lot of what we do and what we need to do. So the different type of frameworks and models that we learned basically help put in perspective, looking at the person, looking at the occupation as well as the environment, to come up with an appropriate plan and intervention in order to get the person back into doing the things they need to do in a functional way. And I agree, the field of occupational therapy seems to, over the years, pretty much lose perspective of client-centered therapy. We basically kind of look at very specific type of intervention, like you have the biomechanic and you have more orthopedic, and you have basic neurodevelopment and sensory integration with children. But we have to really, at the end of the day, when we're working on process skills, we're working on things that are inhibiting occupation, we have to put things back in proper perspective. At the end of the day, it has to be, how does that equate function? I can get a person's range of motion full to 180. I can get a person basically to adapt for their decreased sensation. But what does that mean? Can that person go into their laundry basket, get the laundry, do the laundry, and fold the clothes like they used to? Or is that still a barrier? Is there something that I'm missing, that everything I worked on did not equate function? So what I'm learning is that, since now that I am applying most of the 6 models that we learned in this course to actual therapy, I am documenting every single intervention where I just interview the patient and just assess, okay, tell me, Mr. Smith, what are you doing now that you were not able to do before? What are some of the things that you used to find difficult that you are doing now and you feel that you're doing it on a regular basis? And believe me, I cannot wait until I'm ready to do research, because I'm starting to see a trend with every single one of my outpatients I work with. If it's the low vision or patients in my orthopedic rehabilitation center, they are actually telling me, based on just informal type of interview, they're telling me, like, for an example, my orthopedic patient just told me today, we're probably 4 months in, And I know that the patient basically has increased range of motion, strength, all of the process skills that that patient needs to do functional activities. But I really kind of look at the initial evaluation where the patient gave me goals, where the patient really wanted to get back to occupations that basically he was limited in doing. So I looked at some of the goals that he initially documented, or we discussed initially at the evaluation, and just looking at all the progress he made. And I, interviewed him today, and I said, well, Mr. Smith, what are some of the things you were able to do now that maybe when you first started was pretty difficult, or you couldn't do because of your precautions or restrictions, protocol restrictions? Now that your protocol lifted a lot of those restrictions and we already see that you're stronger, what are some of the things you're doing now? And I was quite surprised that all of the initial goals that he documented initially were all achieved, and we worked on more advanced goals that he wanted to engage in just to get him back into readiness for work. So is this a dynamic thing that I think that with the 6 occupational based models we learn in our course is basically really opening our eyes, getting us more into the practice of using occupational based interventions, evaluation, and really it's an ongoing assessment we need to make, and we need to also document every single outcome in our documentation so that we can pretty much measure change. Every time I see a little bit of change, I always interview the patient to see if that change equates to function. And at the end of the day, that is what really is called for occupational based and meaningful type of intervention. It really kind of distinguished us from the physical therapists and speech therapists and other therapists out there, because we're unique at what we do, and our skill set at the end of the day is always how can we engage in occupation that is meaningful for the person, that's going to get the person motivated to participate and prevent any type of further deficits and or disabilities that the patient may face. So I can go on and I can go on about this, but the takeaway I learned from this course, and also from the wealth of knowledge from my classmates, in the discussion, is that I basically learned a lot from a lot of my classmates who may be engaging in different types of practice of occupational therapy that I might not have the experience in, or they might have more years of experience in, or a different perspective. And I might have not gotten back to everybody in terms of responding to each and every post, but I read every thread, every single discussion thread that everybody in this course documented. And I have learned a lot from all of my classmates, because everyone come in with different types of specialty and different skill set and perspective. And that also helped me reflect in my own skill set and my own perspective to see how I can just change the way I interact with my patient and or coworkers in order to make their therapy more comprehensive. And another thing that I have as a takeaway from this course is that my peers and my coworkers model off of what I do. I notice after just repetition of me doing more occupational based type of intervention, like I work with a stroke patient, and then yes, we're working on process skills, getting range of motion, getting strength and all of that back. But if I'm working with my client who's a chef who wants to go back to work, but he has to wait 3 months, he wants to get back his confidence in cooking. Well, some of my intervention involved cooking. We worked on basic cooking skills. We worked on making soup and sandwiches, little basic things so that he can build the confidence, and his wife can also build the confidence and also feel comfortable with her husband re-engaging in cooking tasks in the home, and just getting that activity, more rote, more practice in that. So when he's ready for work, he has the skill set to regain his activity as a chef or as a cook, a line cook in his restaurant where he used to work at when he's ready to regain work activities after his therapy session. So a lot of takeaways I received from this type of course. And the most large takeaway that I think that we all must remember, because we learned about theory, we learned about the models, the 6 different models, and it really kind of helped guide and frame our evaluation and our intervention. But one thing that I want to basically just leave everyone with is a quote by Dr. Carl Gustav Jung. Okay, he's a psychiatrist and a psychoanalyst from Switzerland, and I just want to read a quote from him. And this is really important because I really am a person who is a client-centered type of therapist, and I look at the person as a whole, and I always have a holistic approach when I work with people. But at the end of the day, this is something very important that just is resonating with me, and I always want to remember when I talk about different types of theories and research and everything. Know all the theories, master all the techniques, but you touch a human soul. Just be another human soul. So with that, I'll just leave you with that. And I really learned a lot from this course, and I am really geared to learning more from this OT program, and also to be one of the contributors to research, because that's really my passion. That's something I would love to do, because I feel that as occupational therapists, we're, especially in this program, we're a vehicle for change. And that's my goal, and I'm hoping to learn more so I can really significantly validate the role of occupational therapy, the field of occupational therapy, as well as grow us as a profession, at least in the Northeast where I live. Thank you so much for listening to me. It's been a pleasure, and I look forward to working with all of you in the future. Take care. Bye.